Dr. Brittany from Strathroy Wagner Chiropractic Health and Wellness Centers, bringing you my case of the week. This week's case involves a patient that presented to my office with bilateral ankle pain. It was mainly concentrated at the back of the ankle around the Achilles tendon insertion, but she would also get shooting pain down into the ankles. The patient had previously seen practitioners and been given the diagnosis of bilateral Achilles tendinopathy. I did agree with this diagnosis, but also added an additional diagnosis of tendinopathy in the peroneal muscle groups. So for treatment, what I did is I did some stretches to the hips and mobilized them. The patient had a lot of tightness in the lateral hip muscle group, particularly the IT band, which I think translated down into the peroneal muscle group. So got that moving again, did some adjustments to the knees. I rock flossed the calf muscles and the Achilles tendon. And then I also did some shockwave therapy to the lateral gastrocs at the origin, as well as the peroneal muscle group and the Achilles group. And then lastly, I did a lot of work to get the ankle moving again. The ankle was very tight, particularly limited in dorsiflexion and plantar flexion. So did some adjustments and some mobilizations to get this moving again. In terms of home-based exercise for this patient, I mainly just gave her some stability exercises for the ankle. She was already doing a lot of stretches and some strengthening for the Achilles tendon. After the initial assessment and treatment, the patient did get some relief from this treatment, which was wonderful. However, the condition was chronic and had been there for a long period of time. An injury is considered chronic if the symptoms have been there for more than 6 months. And these conditions often do not heal really quickly. There's changes that take place in the body when something becomes chronic and can make healing a lot slower for these conditions. But they are getting relief and we're slowly moving along, so that's great.